everyone. As we have introduced that acupuncture and moxibustion is indicated for facial paralysis, I would like to interpret you the regularly selected acupoints for treating facial paralysis. It is known that facial paralysis is the indicated disease of acupuncture and moxibustion therapy. Clinically, about 6 or 7 out of 10 patients are diagnosed as facial paralysis in the outpatients department of acupuncture and moxibustion. And winter or spring usually witnesses higher incidence. Now, acupuncture and moxibustion therapy for facial paralysis is raising and increasing attention. Let's find out what acupuncture points are regularly used in the treatment of facial paralysis in modern research. In our university, Professor Yang Jie and her team once conducted a study then searched the modern literature on acupuncture and moxibustion for facial paralysis and conducted data mining. Firstly, then searched the articles on RCT of acupuncture and moxibustion for facial paralysis published before March 2008 in databases including CNKI, VAPE, and PubMed. Then further manually searched relevant journals including Chinese Acupuncture and Moxibustion, Chinese Journal of Clinical Medicine, Acupuncture Research, etc. Then conducted data mining and collation of the included modern literature on acupuncture and moxibustion therapy for facial paralysis, and summarized a total of 327 relevant research articles published in around 100 journals. Their workload was a bit huge. Then analyzed the literature by extracting the data, and then sorted out the rules of meridian application, acupoint selection, and combination of acupoints. Let's have a look at the details. The first point is the meridian application. In fact, the 14 meridians were all used to treat facial paralysis in these trials. It can be seen that the acupoints of the 14 meridians have been used in modern clinical research on acupuncture and moxibustion for facial paralysis. The top 10 frequently employed meridians are shown in the table. What are these meridians? We could see that the most frequently employed meridian is the stomach meridian of foot Yangming, on which 14 acupoints have been used more than 890 times. The second is the large intestine meridian, on which 6 acupoints have been used more than 300 times. The third is the gallbladder meridian of foot Shaoyang, and its frequency of application has reached over 300 times. 20 acupoints on it are commonly used. The fourth is the foot sun bladder meridian, and its frequency of application has reached over 250 times. 23 acupoints on it are commonly used. The fifth is the Sanjiao meridian of hand Shaoyang, followed by Du meridian, Ren meridian, the small intestine meridian of hand Taiyang, the liver meridian of Fu Jueying, and the spleen meridian of Fu Taiying. What rules can we find out in the top 10 meridians? You may find out that 9 out of 10 meridians travel through the head and face, and then are mainly the yang meridians. All 6 yang meridians are included. In conclusion, the meridians passing through the head and face are used frequently in the modern research of acupuncture and moxibustion for facial paralysis. Among them, the frequency of application of yang meridians is also very high, and yang meridians of stomach, gallbladder, and bladder are the typical cases. There are so many points employed, and the acupoints on stomach meridian are preferentially selected. There are so many points employed, and the acupoints on stomach meridian are preferentially selected. The reason for selecting the stomach meridian is that it passes through the head and face. The stomach meridian and large intestine meridian travel through the head and face. Additionally, the treatment of stomach meridian for facial paralysis was recorded in tendon syndrome. The stomach meridian and the large intestine meridian travel through the head and face. Additionally, the treatment of stomach meridian for facial paralysis was recorded in tendon syndrome. In ancient literature, the symptoms of facial paralysis was recorded in the texts of the diseases of Yangming tendons. This is also a reason why we usually treat facial paralysis as a Yangming tendon disease in acupuncture clinics. So it is not difficult to find that the Yangming meridian is indeed the first meridian for acupuncture treatment for facial paralysis. In the second part, this article analyzed the use of acupuncture points for facial paralysis in modern RCTs. Here is a list of the top 15 acupoints of high frequency. Here is the list of the top 15 acupoints of high frequency. So, it is not hard to say, in the modern research of acupuncture treatment for facial paralysis, the acupoints selected were mainly local, which coincides with the rule of acupoint therapy for local diseases. For example, 13 out of 15 acupoints are on the head and the face, except for Hegu and Zusanli. Among them, the reason for selecting local acupoints is the location of the disease. The 5 most frequently used local acupoints are Dicang, Jiache, Yangbai, Yinxiang, and Yifeng. Dicang locates on the corners of the mouth. Jiache is on the face. Yangbai is an inch above the eyebrows. Yinxiang locates on the center of our nasolabial folds, and Yifeng is behind the ears, where the facial nerves go out of the skull. The selection of these acupoints is according to the clinical manifestation of facial paralysis. Only Hegu and Zusanli are distal acupoints in the top 15 points. The reason for selecting Hegu is that Hegu can treat facial and oral disorder effectively. Zusanli has a function of strengthening the body resistance and protecting the body by sequential meridians. If we analyze the top 15 acupuncture points, we can see that the acupoints for dispelling wind are primarily selected. Because we all know that the pathogenic wind is the leading factor to cause facial paralysis. Acupoints for dispelling wind including Hegu, Yifeng, Fengchi, etc. The third section is about the rule of the combination of acupoints. In fact, the acupoints on the face are combined in application. From the table, we can actually find out that the co-employed acupoints are Dicang, Jiache, Yangbai, and Hegu, etc. This reflects that the local acupoints and chief symptoms are the firstly considered in selecting the acupoints for facial paralysis. Of course, the points combined with Hegu also embody such a feature of combining local acupoints with the distal ones and combining the upper acupoints with the lower ones. The above is the analysis of the modern usage of acupoints for facial paralysis in acupuncture treatment, and I think this will give you some inspiration and some thoughts in the clinical practice of acupuncture and moxibustion. Moreover, it can broaden your academic view on the prescription of acupoints in the treatment of facial paralysis.